Hi, my name is Dr. Vishal Govinda Hari, and I'm a Vitreo retina surgeon practicing at Pushpagiri Eye Foundation. RoP is a disease which is in general managed by good neonatal care and effective and systematic screening. The timeliness of the screening and the thoroughness of the screening are the most important points. So majority of the management of RoP lies in neonatal care and timely screening. The severe forms, once diagnosed and requiring treatment, are often treated by laser, where the retina is ablated or burnt to ensure that it no longer worsens, or injections called anti-VEGF, vascular endothelial growth factor injections, which are given in small doses to help weak babies who are not eligible for laser or babies with very severe forms of retinopathy of prematurity to recover from the disease. Surgery is seldom required, but when required, the eye has quite a challenging situation, and the surgical outcomes of the last stage, which is stage 5, are quite poor. So the onus is to prevent the disease from progressing and keep it at a screening level with effective and healthy neonatal care. RoP is managed by a village of healthcare professionals, to say the least. Right from the person delivering the baby, the gynecologist and the obstetrician, to the most important person in the puzzle, which is the neonatologist, who helps the baby tide over its initial stormy course, to the ophthalmologist, who screens the eye using specialized techniques. An interdisciplinary approach is the best way to tackle RoP. Democratizing the process and training technicians, optometrists who can use well-defined screening cameras, which are made in India as well as available from international manufacturers, is yet another effective way which is making its ground in RoP screening in India today. Another important stakeholder in the management of RoP are the nurses, the sisters, and the technicians who work at the special newborn care units or the intensive newborn care units. These people handle the baby on a day-to-day basis and have a great empathy and great source of attachment to the babies. So training this cadre of staff has proven to be quite effective in eventually preventing the incidence of RoP in these babies. The treatment procedure in RoP have very specified protocols: the weight of the baby, the age of the baby, the stage of the disease, how much the baby can tolerate as a treatment modality, and how each treatment responds, the life cycle of each treatment, and what sort of outcomes are we expecting considering the systemic status of the baby, are some of the determinants on how we treat babies with RoP. RoP in general requires a multi-pronged approach with frequent follow-ups, with the main torchbearers of treatment being laser, injections, and surgeries.